Important story for parents to hear. Rise in teens on TikTok self-diagnosing themselves with rare mental health disorders, in most cases that they don't have, after watching videos on the social platform. It's a story first reported by the Wall Street Journal. Ariel Reshef has more.
DID typically occurs between the ages of 6 and 9.
Experts warning about what they call a troubling trend on TikTok that could leave some teens believing they have a serious mental disorder.
Hello.
Posts with the hashtag dissociative identity disorder and borderline personality disorder viewed hundreds of millions of times. Some of those videos listing possible signs to look out for and encouraging viewers to self-evaluate. 18-year-old Samantha Fridley says she was convinced she was suffering from one of those conditions.
I remember just seeing these videos like on my For You page about just like people saying like, oh, here's signs you may have this disorder. Like it was like bipolar or like borderline or all these different like rare disorders I've never even heard of before. And my mind like would just be like, you know, like maybe I don't have just depression and anxiety, maybe it's something else.
According to the National Alliance on Mental Illness, borderline personality disorder is extremely rare. Only 1.4% of the U.S. adult population is estimated to have this condition, and it is rarely diagnosed in adolescence.
If you spend 15 minutes, 30 minutes, 60 minutes viewing people talk about these disorders over and over and over again, that can make it seem like these conditions are a lot more prevalent than they actually are in the world.
After working with a therapist for a long time, I started realizing, you know, that I don't have borderline, I don't have dissociative identity, I don't have bipolar.
But experts urge parents to maintain an open line of communication with their kids about mental health.
Take the time to empathically hear them out. How intense are these symptoms? How long are they lasting? Does it seem like they're interfering with your child's ability to live the life that they want to live? Again, if the answer to those questions is yes, that's a cue to then take the next steps to get a formal diagnosis.
In a statement to ABC News, TikTok says they care about the well-being of their community and have invested in digital literacy education. The company adding, we strongly encourage individuals to seek medical advice if they are in need of support.
That was Ariel Reshef reporting. We want to bring in now the director of Health Disparities Institute and associate professor of psychiatry at UConn, Dr. Wisdom Powell. Dr. Powell, thanks so much for taking the time this morning on such an important topic.
Thank you for having me, Phil.
You know, when you're sick and have the sniffles and you Google it, you can wind up down a rabbit hole. This is so much more scary than that. These videos are shared and viewed hundreds of millions of times. The obvious question, how can self-diagnosis be a really slippery slope?
This is a really important topic, Phil, because self-diagnosis does increase the danger of both symptom amplification and minimization. What can happen is what we sometimes refer to as a horoscope effect. It's when you read symptoms online and you feel really connected to it, so much so that you believe that you must now have that particular diagnosis. And we know, for example, that it takes a professional really to sort out the difference between a symptom and an actual clinically relevant diagnosis. And the challenge with self-diagnosis also is that you may miss things that are masking physical health problems. We know that there's a high degree of comorbidity between physical symptoms and psychological ones. And sometimes a heart palpitation could mean that you need to see a doctor for your cardiovascular health and not necessarily that you have anxiety or depression or other more serious mental illness.
Yeah, and the parents of a teenager, I'm the parents of two teenagers, you know it's a scary age because they're susceptible to a lot of what they're seeing on social media, and you certainly don't want kids that age diagnosing themselves for anything. As we heard in the piece, the National Alliance on Mental Health Illness says borderline personality disorder is extremely rare. We're talking only 1.4% of the U.S. adult population is estimated to have the condition, and it's rarely diagnosed in adolescence, period. But a lot of these videos have good intentions behind them and aren't meant to elevate conversation, or are meant to elevate a conversation, rather, about mental health. So is that what's happening here, or are we seeing more harm than good?
So this is a really important topic also, because we know that this tendency to turn to social media for medical and mental health advice probably also reflects the emergent crisis that we're facing with youth and teen mental health. We know that there have been upticks in mental health issues, including depression and anxiety among teens and youth. And so the fact that they're turning to TikTok and other social media platforms probably suggests that we're not meeting them where they are. We know that in our nation right now that there are not enough psychiatric beds. We actually have a shortage of mental health professionals and therapists. So I can understand why youth would turn to these platforms for support. So I don't think that this is a trend that we're going to see go away. So the important thing for us as parents, as a community of mental health professionals, is to pay attention to these things. Because as you noted, some of the diagnoses that children and youth are coming up with or that they're attaching themselves to reflect really serious mental health problems that are very, very rare. And those kinds of diagnoses require physician or clinical intervention to really solidify and also to assure that parents and teens are getting the right and appropriate mental health treatment for those concerns.
Dr. Wisdom Powell, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.